Depression in Young Adults, presented by Taylor Garner. Depression is defined as a mental disorder that negatively affects the way you feel, think, act, and perceive the world. 18% of adults are experiencing depression. Depression is more commonly seen in women than in men, and some symptoms of depression include feeling sad, irritable, or helpless, loss of pleasure doing activities you once enjoyed, change in appetite, sleeping too little or too much, decreased energy. Depression has various treatments, but the most used treatment is selective serotonin reuptake inhibitors. These medications are heavily relied on because they increase available serotonin while also being a more safe and tolerable option for treating depression. The research question is cognitive behavioral therapy more effective than SSRI treatment in producing long term improvement in depression among young adults aged 18 to 25? My first reference that I'm using is an evidence summary that reviews the use of SSRI and SNRI antidepressants in treating depression among young people, including young adults up to age 25. The findings indicate that psychological therapies such as cognitive behavioral therapy are recommended as the first line of treatment, with antidepressant medication considered only when therapy alone is insufficient or when depression is moderate to severe. Among antidepressants, fluoxetine is the most strongly supported SSRI for use in this population, while evidence for other SSRIs and SNRIs remains limited and inconsistent. Additionally, the article highlights important safety concerns, particularly an increased risk of suicidal thoughts and behaviors in young people using antidepressants. Overall, the summary emphasizes cautious use of medication, close monitoring, and prioritizing psychological interventions when treating depression in young adults. My second reference, the IQWIG HTA reported evaluated whether psychotherapy is effective for treating depression in children and adolescents compared to other treatment approaches. The findings indicate that cognitive behavioral therapy and interpersonal psychotherapy can reduce depressive symptoms more effectively than no treatment or waitlist controls. However, the report found no clear evidence that psychotherapy is superior to antidepressant medication or that combining psychotherapy with medication leads to better outcomes. Due to limited and inconsistent data, conclusions about long-term effects, quality of life, and suicide risk could not be confidently drawn. Overall, the report supports psychotherapy as a beneficial treatment option while highlighting the need for higher quality research. Finally, the BMJ systematic review and meta-analysis compared cognitive behavior therapy with second-generation antidepressants, including SSRIs, for the treatment of major depressive disorder in adults. The findings show no significant difference in treatment effectiveness between CBT and antidepressants in terms of symptom reduction or remission. Adverse events and treatment discontinuation were also similar between the two approaches. Although the evidence was rated as low to moderate due to variability across studies, the results support CBT as a viable alternative to medication, particularly for patients who prefer a non-pharmacological treatment. Depression is often rooted in persistent negative thought patterns, emotional dysregulation, and maladaptive coping mechanisms, rather than solely neurochemical imbalances. While antidepressants can reduce symptoms, they may not address the underlying cognitive processes that contribute to depression. From personal experience, antidepressant treatment can create a sense of emotional blunting, where happiness feels artificial rather than internally developed, highlighting the importance of therapies that promote genuine emotional processing. A randomized control trial comparing cognitive behavioral therapy to SSRI use in young adults is essential to determine which approach leads to more sustainable long-term improvement. CBT focuses on developing coping skills and restructuring negative thought patterns, which may reduce relapse rates and dependence on medication. Conducting a randomized control trial would provide stronger evidence to guide treatment decisions, especially for young adults who may experience long-term medication use during critical developmental years. Luke chapter 7 verses 1 through 10 illustrates the power of faith in an internal transformation. As the centurion trusts that healing can occur through belief and understanding rather than direct intervention. This perspective aligns closely with cognitive behavioral therapy, which focuses on changing internal thought patterns to influence emotional and behavioral outcomes. While medication can play an important role in symptom relief, CBT empowers individuals to actively participate in their healing by developing lasting cognitive and emotional skills. Integrating faith into this discussion reinforces the idea that healing involves both scientific intervention and personal belief, supporting the need for further research to determine how internal, skill-based therapies like CBT may produce more enduring outcomes. And these are a list of my references used for this presentation. Thank you.